HealthConnection, medical assistance for all. A health awareness initiative by HealthConnection. Weight loss surgery and bariatric surgery. It includes a variety of procedures performed on people who have obesity. Weight loss is achieved by reducing the size of the stomach with gastric band or through removal of a portion of the stomach, or by resecting and rerouting the small intestine to a small stomach pouch. Surgery should be considered as a treatment option for patients with a BMI of 40 kg per meter square or greater who instituted but failed an adequate diet program. Obesity-related comorbid conditions: hypertension, impaired glucose tolerance, tightness or pain in the chest, hyperlipidemia, obstructive sleep apnea. We thank Dr. Ajay Kriplani, Director and HOD, Fortis Memorial Research Institute, Gurgaon, for explaining bariatric surgery and supporting our initiative.
Hello, I am Dr. Ajay Kriplani, Director and Head, Department of Minimal Access Bariatric and GI Surgery at Fortis Memorial Research Institute, Gurgaon, earlier Professor of Surgery at the All India Institute of Medical Sciences, New Delhi. This public education and awareness program is brought to you in association with HealthConnection. Fortis Hospital, Gurgaon is a high volume center for performing bariatric surgeries, or what is called as weight loss surgeries. These are patients who are very heavy, much higher than their average weight, and some of these patients commonly weigh 140, 150 kilograms, and our highest weighing patient has been 240 kilograms. Because of the weight, these patients suffer from other diseases which is caused because of their weight, and these diseases are diabetes, hypertension, sleep apnea, joint problems, particularly osteoarthritis of the knee because of which they cannot walk, spine pain, slip discs, and many others. We call this condition morbid obesity when the weight has become so much that it gives rise to other diseases. Instead of treating each disease separately, like diabetes or sleep apnea or joint pain, if we treat the root cause of pain, which is excess weight, then the patient benefits on all accounts, and with taking out the root cause of these problems, the patient gets great benefits in all associated conditions. And this surgery is called as bariatric surgery. Bariatric surgery is a resource intensive surgery, that is, such surgeries should be performed at centers which have good infrastructures, because to operate on these heavy patients requires coordinated efforts and care which cannot be given in an ordinary small hospital. There are two types of bariatric surgery: laparoscopic sleeve gastrectomy and laparoscopic gastric bypass. And we decide which is the best treatment for the patient depending upon his age, his weight, whether there is diabetes mellitus or not, and other comorbidities which may be associated. For patients who are young, whose BMI is less than 50, we prefer laparoscopic sleeve gastrectomy. But for patients who have diabetes, patients who have higher BMI, we prefer laparoscopic gastric bypass. Another offshoot of bariatric surgery is metabolic surgery, which earlier was unheard of. Like so far, whenever a patient had diabetes, he will go to the physician, take tablets or insulin, and then we say the physician is controlling diabetes. But now the concepts have changed. As surgeons, we talk about cure of diabetes. This was almost unheard of, that a diabetic patient can become non-diabetic and not need any drugs to control it. And that is what has been made possible by metabolic surgery. We have so many patients who have benefited from this. Their diabetes is absolutely under control and they are enjoying a normal free life. Another advantage of bariatric surgery and metabolic surgery is that it adds years to their life. It is well known that patients who are very heavy, whose BMI is more than 40, do not live as long as their normal counterparts with normal weight. If you look around in the society, you will hardly find people surviving more than 70 years if they are diabetics. Most of them are lean and thin. It is a general calculation that those who are obese, they lose 7 years of life. And if you get operated, lose the weight, then you regain the 7 years of life. So not only you live longer, but your quality of life improves, you can be more mobile, you can enjoy the social activities and outings, and really you can make your life worth living. At Fortis Memorial Research Institute, Gurgaon, we practice laparoscopic surgery in its most advanced form. The most simple example of this is surgery of the gallbladder, which is the commonest laparoscopic surgery performed world over. Traditionally, this operation is performed by 4 small punctures through which 4 different instruments are passed and the gallbladder is dissected out and removed. The disease is more common in females and particularly younger females. At Fortis Hospital, Gurgaon, we practice laparoscopic cholecystectomy in a totally different way, what is called as single incision laparoscopic cholecystectomy. In this way, instead of making 4 punctures or 4 cuts on the skin, we make just 1 cut within the belly button so that the scar is hardly visible. This is called as scarless laparoscopic gallbladder surgery. In the evening, when we visit our patients, the patients are most amazed to see that there is virtually no cut visible on their skin, and this gives these young females a great satisfaction and pleasure. It is not only important to perform the surgery by single cut, but it is also important that the surgery should be as safe as multiport cholecystectomy, in which we have a huge expertise and we are an institution performing highest number of laparoscopic single incision gallbladder surgeries in the world. Because the number of cuts are reduced from 4 to 1, the pain also is significantly reduced. Patients are active earlier and are more comfortable when they go home the next day. Our technique of single incision laparoscopic surgery is very unique. We have ourselves designed and innovated it. We do not use any significant disposable instruments so that the procedure is very cost effective and there's a minimum rise in the cost. In the Western world, lots of disposables are used which significantly increase the cost of single incision laparoscopic surgery. Centers in the Western world who are performing single incision laparoscopic gallbladder removal do not entertain patients who are very obese or patients who have acute infection in the gallbladder. Our experience and expertise with single incision gallbladder surgery is so much that we do not reject even these patients and give them the benefit of single incision laparoscopic gallbladder removal. If the patient has diabetes of less than 5 years, almost 85% of patients after metabolic surgery will become non-diabetic and will not require any medication. In another 15% of patients, there is a significant improvement in diabetes in the terms that those whose diabetes was earlier not controlled even with drugs will become controlled, and that the amount of drugs that they were taking will be significantly reduced. Similarly, if a patient has sleep apnea in which he snores during sleep and cannot breathe properly, these patients are on the BiPAP machine during the night, and 95% of these patients will be off machine and will not experience sleep apnea during the night. This is what makes the surgery more precise, and therefore the patients benefit from this surgery. More and more surgeries are being now performed by robotic means. Common amongst them are complicated GI surgeries like laparoscopic removal of the colon for cancer, like repair of large hernias in the abdominal wall, what we call as robotic transversus abdominis release or robotic TAR. Complex surgeries involving the adrenal gland, involving the pancreas, involving the spleen are now more and more being performed biorobotic platform with more precision and faster and better recovery of the patients. Thank you. Have a good day.
Special thanks to Mr. Sudhir Gopalia and the management team of Fortis Hospital in association with HealthConnection.
Medical disclaimer: the information in this video is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information, contained on or available through this video is for general information purposes only. It is not intended as medical advice, and should not be relied upon as a substitute for consultations with qualified health professionals who are familiar with your individual medical needs. The whole sole purpose of this video is to make people aware of healthcare and medical knowledge and developments. We at HealthConnection specially recommend you to visit an authorized physician nearby for medical opinion, medication, treatments, or procedures. For more details, kindly visit our website www.healthconnection.in, or if you have any questions, comments, or concerns, please do not hesitate to write to us at info@healthconnection.in.